Okay, let's unpack this. Imagine a single, seemingly healthy animal on a farm. But it's actually a ticking time bomb, silently spreading this devastating disease that cost an entire industry billions. Sounds like, I don't know, science fiction,
Yeah,
right?
it really does.
Well, today we're taking a deep dive into the real-world challenge of bovine viral diarrhea, or BVD, and its even more severe cousin, mucosal disease, in cattle.
Yeah, and what's truly fascinating here, I think, is just how complex this virus, BVDV, really is. It's not just one straightforward illness, it's more like a whole spectrum of conditions. Some are mild, almost invisible, others are, well, they're fatal, and the economic ripple effects are felt everywhere globally.
Right.
So for this deep dive, we're looking at insights from two really comprehensive sources, bovine viral diarrhea and mucosal disease in cattle, and also bovine viral diarrhea, etiology, impact, and control strategies. Our mission really is to understand how this virus works, why it's so incredibly persistent, and what critical strategies we need to actually combat it.
And it really raises a key question for you, our listener. How does one apparently silent animal become this hidden linchpin, basically determining the health and the economic future of an entire herd?
Exactly, it's a crucial question.
So to start unraveling this, let's get into the culprit itself. What exactly is BVDV, and what makes it such a formidable foe?
Okay, so at its core, BVDV is a single-stranded RNA virus. You can kind of think of it as a master of disguise. It belongs to a group called pestiviruses, part of the Flaviviridae family, and they're known for being particularly tricky, often causing these persistent infections.
Okay.
Now, what's really crucial to understand about BVDV is how we classify it. First, you've got two main genetic types, BVDV1 and BVDV2. Pretty standard. But even more fundamental than that, it exists in two biotypes.
Biotypes.
Yeah, biotypes. One we call cytopathic, or CP, and the other is non-cytopathic, or NCP. And this distinction, CP versus NCP, it's absolutely fundamental to understanding the whole picture, especially mucosal disease later on.
Okay, so these biotypes, they're central. Can you break down what makes them different and why that matters so much?
Absolutely. So think of it like this. The non-cytopathic, the NCP strain, that's the stealthy one. It often hides inside cells without causing immediate, obvious damage, and it's the key player, the one responsible for creating those persistently infected animals, the PIs we'll talk more about.
Right, the hidden threat.
Exactly. Now, the cytopathic, or KP strain, that's the killer. It directly destroys cells. It's the one responsible for that devastating mucosal disease. So you see, one kind of sets the stage, the NCP, and the other, the cup, delivers the final, often fatal blow.
Wow.
And just to add another layer of complexity, there's this emerging concern now about Hobie-like pestiviruses. Some people call them the BVDV3.
BVDV3.
Yeah, they're spreading globally, and the big worry, the big question for the industry is whether our current vaccines actually offer enough cross-protection against these newer variants. It's something we're watching closely.
That's definitely a critical point, these emerging strains. Okay, so this virus sounds incredibly adept. How does it actually move around, both within a herd and maybe beyond the farm gate? And what about everyday objects? Do they play a role?
Oh, it's incredibly good at spreading. So the most common way is just direct contact between an infected animal and a susceptible one. That's your standard horizontal transmission. And that absolutely includes contact with those critical PI animals.
The super spreader.
The super spreaders, exactly. But here's where it gets maybe a bit alarming. BVDV is also readily spread through contaminated inanimate objects, what we call fomites in vet terms.
Fomites. Like what specifically?
Well, think about shared water buckets, calf feeders, IV equipment, noseleads, even someone's boots or clothing, or a cattle truck that hasn't been properly cleaned and disinfected between loads.
Wait, so even things like an ear tagger or a dehorner, stuff you might just quickly wipe down.
Precisely. Our sources really hammered this point. Farm, medical, and surgical instruments. Needles, dehorners, ear taggers, castrating knives, tattoo instruments, even hoof knives. If these aren't meticulously cleaned and sterilized between each animal, they become perfect vectors for the virus.
That's sobering.
It is. And what really jumped out at me was that the virus can survive in the environment, like on those surfaces, for more than 2 weeks.
2 weeks. Wow.
Yeah, that's a surprisingly long time for a virus like this, outside of an animal. Then, of course, you've got vertical transmission. That means an infected dam passing the virus to her fetus, especially if she gets infected herself between, say, day 40 and day 120 of her pregnancy.
That specific window again?
That specific window. And yes, semen from infected bulls is another known route, so you can see there are just so many potential ways for this virus to get in and spread.
Okay, this brings us to what seems like the absolute core of the BVDV story, this concept of a persistently infected, or PI animal. You've mentioned them a few times. It seems totally central to how the virus hides and causes so much long-term trouble. So what exactly is a PI animal? How do they happen?
PI animals are, honestly, they're the heart of the BVDV problem. A PI calf is born when a susceptible pregnant cow, one that hasn't seen BVDV before, gets exposed to that non-cytopathic, that stealthy NCP strain during that critical window, typically between day 30 and day 125 of gestation.
Right, when the fetus is developing its immune system.
Exactly. During this time, the fetal immune system is still learning what's self and what's foreign. If the NCP-BVV gets in there, then the immune system makes a mistake. It becomes immunotolerant to that specific strain of BVDV.
Immunotolerant, meaning it just accepts the virus, doesn't see it as a threat.
Precisely. It sees the virus as a normal part of its own body, not an enemy to attack. So it never mounts an immune response against it. Never. And the result is these PI animals are infected for their entire life.
For life.
For life.
Right.
And they continuously shed just massive quantities of BVDV. It's in their nasal discharge, saliva, urine, tears, milk, semen, feces, you name it. They are the primary reservoir, the super spreaders, constantly seeding the virus into the environment and infecting any susceptible herd mates.
And they look normal.
That's the really dangerous part. Many PI calves look perfectly healthy, especially early on. Maybe a bit unthrifty sometimes, but often indistinguishable without testing. It makes them incredibly hard to find. And their prognosis isn't good. Maybe only about 20% even survive to 2 years old. So if the PI animal is the silent spreader, mucosal disease, MD, that's the tragic, usually fatal outcome that can eventually hit them. And it only affects animals that are already PI.
Only PI animals get mucosal disease.
Exclusively. What happens is a PI animal, which is already carrying that NCP BVDV it's tolerant to, gets super infected with a cytopathic DVDV strain. Now, this keep strain could come from an outside source, another animal maybe, and this is thought to be more common, it's a spontaneous mutation. The NCP virus, already inside the PI animal, just mutates into the deadly key form.
So the virus it was ignoring suddenly turns into a killer inside its own body. That's quite a twist.
It's a devastating twist. The FINI BVDV induces something called apoptosis programmed cell death. It basically tells the animal's own cells, especially in the gut lining, to self-destruct. This leads to widespread, severe ulcers all through the digestive tract, causing horrific, often bloody diarrhea, rapid weight loss. It's almost always fatal. And it typically strikes PI animals when they're between about 6 and 18 months old.
Just awful. So, okay, we have this whole spectrum of disease, from barely noticeable signs right through to, well, that. How does BVDV actually look on the ground? What are the signs farmers might see?
Yeah, the clinical signs are incredibly varied. It really is a master of disguise. So with what we call acute or transient BVD, it's often subclinical. You might not even notice anything's wrong.
Nothing at all.
Maybe just a slight dip in milk production. Perhaps a mild fever, around 104 Fahrenheit, maybe a bit of runny nose or eyes, some mild diarrhea. But they usually recover quickly and develop antibodies. But then you have a severe acute BVD. This is often associated with those BVDV2 strains.
The more aggressive ones.
Generally, yes. Here, the picture is dramatically different. Very high fevers, sometimes up to 107 Fahrenheit. Painful ulcers in the mouth, eruptive sores around the hooves on the coronary band, which makes them really lame, and this condition called thrombocytopenia.
Thrombocytopenia. Oh, serious. What does that mean for the cow?
It means a dangerously low level of platelets in the blood. Platelets are essential for clotting, so without enough platelets, they can start to bleed spontaneously. You see these tiny pinpoint hemorrhages called petechiae, especially on the gums or inside the eyelids, and they often have severe bloody diarrhea because of bleeding in the gut. Mortality in these severe outbreaks can easily top 25%.
Quarter of the affected animals.
Yeah.
Gone.
It can be devastating. And PI animals themselves, while often looking normal, can just show poor growth, chronic ill thrift. They just never seem to do well.
The effects on unborn calves. You mentioned that critical window.
Right. The in utero infections. They can be heartbreaking. If the fetus gets infected later in that development window, say between 80 and 150 days of gestation, the virus can cause teratogenic effects, birth defects.
Actual physical malformations caused by the virus.
Exactly. Things like cerebellar hyperplasia, the cerebellum, the part of the brain controlling balance and coordination, is underdeveloped. These calves are often called dummy calves. They're uncoordinated, they stumble, can't stand properly. You can also see eye problems like cataracts, spinal cord defects, even damage to the thymus gland, which is
Yeah.
crucial for the immune system. So even non-PI calves born in an infected herd can suffer from weakened immunity, making them prone to things like pneumonia.
It just attacks from so many angles.
It really does. But arguably, the single biggest economic hit comes from the reproductive problems. BVDV is a major cause of reduced conception rates, cows not settling, early embryonic death, abortions at various stages, mummified fetuses, stillbirths, and of course, the birth of those PI calves if the infection hits between day 30 and 120.
And you said a PI cow always has a PI calf.
Always. Every single time. It's a guaranteed transmission. Plus, in older producing animals, BVDV infection can knock down milk yield and increase rates of mastitis. It's just a constant drain on productivity.
So it really sounds like BVDV isn't just a health crisis, it's this profound, often hidden economic drain.
Yeah.
What does this all add up to? What's the bottom line globally?
The economic impact is, well, it's staggering. BVDV is consistently ranked as one of the most economically costly cattle diseases worldwide. We're talking global annual costs estimated somewhere between 1.5 and 2.5 billion US dollars.
Billion, with a B.
With a B, yeah. And to bring it down to farm level, U.S. producers might be losing $50 to $100 per head per year across their herd. In New Zealand, estimates were around $22 per dairy cow, over $41 per beef cow annually. Ireland, before they started their big eradication push, figured it was costing them over $100 million every year.
Wow. So it's not just the obvious things like vet bills or dead animals, is it? It's like this invisible tax on everything.
That's a great way to put it. It's a silent tax on efficiency. You know, the reproductive losses alone account for nearly half, about 44% of the total cost. Just having PI animals around, even if they look okay, makes up another 16 to 19% of the cost. There was a study in Scotland estimating a single PI animal costs about $35 per cow per year in a dairy herd and $55 per cow per year in a beef herd, just by being there and spreading the virus.
Just one animal causing that much loss.
Absolutely. Then add in milk production, drops sometimes up to 23% during an acute outbreak, increased calf sickness and death. And the often underestimated cost of immunosuppression BVDV weakens the immune system, making cattle way more susceptible to other things like pneumonia or calf scours, leading to more treatments, more losses. It just compounds.
But there's some good news, right? You mentioned control programs.
Yes, definitely. The positive takeaway is that control programs are highly cost-effective. Studies show benefit-to-cost ratios around 2.02, meaning for every dollar or pound or euro you invest in BVD control, you typically get about 2 back in terms of reduced losses and improved productivity. It pays off.
That is hopeful. Okay, so knowing what we're up against, knowing the stakes, how do we actually find these silent spreaders and put effective control measures in place? Let's talk diagnosis and prevention strategies.
Right. Accurate diagnosis is absolutely key. So for detecting the virus itself, especially for finding those PIs, PCR is a workhorse. Polymerase chain reaction, it's highly sensitive, it's pretty quick, you usually get results in a couple of business days, and you can run it on various samples, including ear notches, which are really handy for testing young calves.
Ear notches, like a little piece of the ear tissue.
Exactly. A small tissue sample taken with special pliers. Another good test, especially for ear notches, is the antigen capture ELISA, or ACE test. It directly detects viral protein. And using ear notches for this test is great because it avoids the problem of maternal antibodies interfering with the results, which can happen with blood tests in very young calves. ACE results can be fast too, sometimes just 20 minutes or up to a few days depending on the lab setup.
Okay, so those find the virus. But you mentioned needing to retest PIs.
Yes, absolutely crucial. If you get a positive antigen test, PCR or ACE, on a calf, you must retest that same animal again after at least 3 weeks. Why? Because a calf might have a temporary transient infection it will clear. But a true PI animal will still be positive for the virus antigen 3 weeks later, and typically it will be negative for antibodies against the virus it's carrying. That confirmation step is vital before you decide to cull.
Makes sense. Don't want to remove the wrong animal. What about checking the whole herd status, maybe if you haven't had obvious problems?
Yeah, for herd-level screening or checking for exposure, we usually look for antibodies using ELISA tests. You can test individual blood samples, or for dairy herds, a really efficient way is to test the bulk tank milk. It gives you a snapshot of the herd's exposure. The challenge again, though, is interpreting results in young calves due to those maternal antibodies they get from colostrum. They might test positive for antibodies, but it's just their mom's protection, not their own exposure.
Right. Got to be careful with the young ones. Okay, so diagnosis is sorted. What about prevention and control? What's the game plan?
It really has to be a multi-pronged approach. But the single most critical step The absolute cornerstone of any control program is identifying and removing those PI animals.
Getting the super spreaders out.
Exactly. Ideally, all calves should be tested early, using that ear notch method, preferably. If an animal tests positive, you confirm it with the retest, and then that confirmed PI animal needs to be removed from the herd immediately. No exceptions. That breaks the main cycle of transmission right there.
Sounds like the silver bullet, getting rid of the PIs. But, in the real world, what are the biggest hurdles for farmers actually doing that? Yeah. Especially maybe smaller farms. It can't be quite that simple.
That's a really important point. It is the crucial step, but no, it's not always simple. For smaller operations, the cost of testing every single calf can be a significant upfront investment. And then there's the logistics and sometimes the emotional difficulty of culling an animal that, remember, might look perfectly healthy at the time.
Right, culling a healthy-looking calf.
Yeah.
That's tough.
It is tough. There's often a strong bond. But the evidence, the economic data, is overwhelmingly clear. The short-term cost and difficulty of finding and removing PIs are far, far outweighed by the long-term benefits of having a clean herd in terms of health, productivity, and ultimately profitability.
So PI removal is number one. What else? Biosecurity must be huge.
Absolutely critical. Your next line of defense. The ideal, though not always practical, is maintaining a completely closed herd, no new animals coming in. If you do have to buy animals, strict biosecurity means isolating them for at least 30 days and testing them for BVDV before they mix with your main herd.
Test before you mix.
Pest before you mix. Avoid sharing bowls or using communal grazing areas, as those are easy ways for the virus to jump fences. And within the herd, good fencing helps. Ideally, double perimeter fencing. And this is vital, back to the fomites. Thorough cleaning and disinfection of anything shared, trailers, handling facilities, loading chutes, and especially those farm medical instruments we talked about. Needles, dehorners, taggers, castration knives, hoof knives. Clean and disinfect meticulously between animals, or better yet, use single-use disposable items whenever possible.
Needles especially, right? One needle, one cow.
Ideally, yes, or thorough sterilization. Also, basic stuff like good sanitation, proper manure management, even fly control can play a small role. And think about colostrum management. Ideally, feed colostrum from cows, are BVD negative. Freezing colostrum from positive cows might inactivate the virus, but it's not guaranteed. And definitely never feed bloody milk, as it could contain the virus.
Lots on the biosecurity front. What about vaccines?
Vaccination is definitely a key component, part of the overall strategy, but it's not a magic bullet on its own, especially if you still have PIs shedding virus. Both inactivated or killed vaccines and modified live vaccines, MLV, are available. MLVs generally provide stronger, longer-lasting immunity and better cross-protection against different strains. Using a bivalent MLV that covers both BVDV type 1 and type 2 is really important for protecting the fetus during pregnancy.
And timing matters.
Timing matters. You want to vaccinate animals during periods of low stress and before they're likely to be exposed. For calves, because of those maternal antibodies we keep mentioning, vaccination is typically started at or after 4 months of age. Before that, the mother's antibodies can interfere and prevent the calf from developing its own good immunity from the vaccine.
Okay. And treatment. If an animal does get sick.
Unfortunately, there's no specific antiviral treatment for BVDV itself. Management focuses on supportive care, fluids for dehydration, antibiotics to handle secondary bacterial infections like pneumonia that often crop up because of the immunosuppression, maybe anti-inflammatories for fever and pain. But for mucosal disease, the prognosis is extremely poor. It's almost always fatal, and sadly, euthanasia is often the most humane course of action.
What a complex virus. This deep dive, it's really shown just how intricate BVDV is, from that unique life cycle with the PI animals, the silent spreaders, to the absolutely devastating economic impact it can have. It really highlights this delicate balance of health within a herd.
It absolutely does. And if we sort of zoom out and connect this to the bigger picture, that emergence of Hobie-like pestiviruses, the BVDB3 we mentioned, viruses that act a lot like BVDV but might not be fully covered by our current vaccines, it really raises an important question for you, the listener, to think about. As new viral threats emerge and existing ones like BVDV continue to evolve, what might be the next challenge like this? The next Hobie-like virus waiting in the wings, perhaps affecting agriculture, maybe even other industries? And maybe more importantly, how prepared are we really as a global community to adapt our surveillance, our diagnostics, our control strategies before these new threats become widespread and start costing us even more?